This is Jerry Hesch, and this is the second part of our filming on our client, and the diagnosis is sacroiliac instability question mark, and that has been her medical diagnosis. Sacral spring test injury, which happened during medical school in April of 2013, and this is January 4th of 2014. And so we're going to show, I got her up in child pose, actually I asked her to get up in child pose, and I just want to show this position. You can come from the side, and the asymmetry of her pelvis is very consistent whether she's standing or lying on her stomach or laying on her back. And would you go ahead and lie down again? I just want to show the quality of movement. And then could you get back up in child pose?
I'm going to have to roll over like I did last time. Is that okay?
Of course, of course. That's what I'm... So we're just demonstrating how difficult it is for her to make simple transitional movements. And let's go ahead and have you lay back down on your stomach. Her whole body is very much in a protective mode. She has increased tone in all of her soft tissue throughout her body. And when she lies prone, the left lower quadrant of her sacrum is prominent. I need to be extremely cautious with any force that I put into this area, especially on the right side. So I'm not going to do the traditional spring test that I do. However, I feel okay doing a spring test far away. Okay, so I'm under the ischial tuberosity here, and it's very hard to load with a normative amount of force. So there's no movement going in that direction. Of interest on the left side, I can take up the slack and I can spring. I can see movement happening through her whole body. I can see her heels bobbing up and down. So I can put force through the body on that side, which is congruent with her having what is called a left posterior ilium pattern. On the right side, that movement is impossible. It feels like I'm pushing against a brick wall. And on the right side, there's no vertical mobility. Try as I may, with a reasonable amount of force, I'm not creating any movement. So you'll see that when she lays on her back, there's a significant asymmetry in the pelvis, and the terminology would call it an anterior ilium on the right. If that were true, then she would rotate, she would have the ability to rotate further into that pattern, and that in fact is not true. I cannot create any PA, ignore the angle of my arm, my direction of force is this way. I can't create any movement there. So that tells us that there's more going on. This has a greater complexity. And what cued me off initially was the palpatory exam, which I don't trust. I almost never trust what I palpate. I trust more a movement or a lack of movement. Okay, I don't treat on the basis of how something looks. But the right PSIS is posterior, it's prominent. And with an anterior ilium, it's supposed to be anterior, superior, and lateral. Okay, it's actually posterior, although it is superior. That speaks to a pattern I discovered in which a person gets an upslip and the ilium, based on the joint configuration, whips medially. As it ascends, it whips medially and creates posterior PSIS and an anterior ASIS. So the pelvis actually looks like it's wider front to back. And we already talked about the sacral torsion, and I'm just not willing to spring her sacrum. Just not going to do that. She does not have hip extension on the right side. You can see how protective she is. She doesn't even like me to slightly flex her left knee. She'll let me do it. But she also cautions me about putting my hand on the right side of her pelvis. It is so hypersensitive. I can extend her right hip 10 degrees. She's completely cooperative with me. I'm going to do the same thing on the left. And you can see that protective guarding kick right in. I'm having a hard time bending this knee, but she's letting me. You know, as best she can, she's allowing me to do this. And so I'm going to stop here at 90 degrees, and I'm trying with a reasonable amount of force, and I cannot lift that hip into extension. You'll see that pattern repeated when she's prone. She also has a stuck right hip joint. You could call it a psoas spasm. Call it whatever you want. We need to restore extension in this hip. I call it a posterior glide